And welcome to today's press conference on primary care options in New Brunswick. Bon après-midi tout le monde et bienvenue à cette conférence de presse concernant
So welcome everyone and welcome to today's press conference on access to primary health care in New Brunswick. The spokesperson this afternoon is the Honorable Dorothy Shepherd, Minister of Health.
Will be the Honorable Dorothy Shepherd, Minister of Health. Minister Shepherd.
Good afternoon, everyone. Bonjour.
Good afternoon, everyone.
Pleasure to be with you today for a very important announcement about a new project to give residents more options to access faster care and avoid long waits in the emergency department. This project advances commitments in the health plan to improve access to primary health care, as well as addictions and mental health services, and to make better use of all the health professionals across our province, including family doctors, nurse practitioners, pharmacists, and more. As you know, New Brunswick's hospitals are offering urgent and emergency services only as the system strains against the demands of the Omicron variant. About 60% of New Brunswick's typical emergency department patients could be treated in a community setting if more timely access was available. We can provide these individuals with better options to care and provide relief to the outstretched teams in our ERs at the same time. These changes will allow us to address the emergency department crisis while also evaluating new options for care and determining what works best for New Brunswickers when it comes to accessing healthcare services. Primary health care is a term used to describe the first contact a person has with the health system when they have a health problem or issue that is not an emergency. C'est le partie du système de santé que les
This is the part of the healthcare system that people use the most. Family doctors, pharmacists, and nurse practitioners are examples of service care providers.
The health system that people use most. Family physicians, nurse practitioners, and pharmacists are an example of primary health care providers. Access to primary health care services has been an issue in this province for a long time. The New Brunswick Health Council has been tracking primary health care access for a decade. It released a new report in November that indicates 91% of New Brunswickers have a primary care provider, either a family doctor or nurse practitioner. This is one of the highest rates in the country. However, only 57% of New Brunswickers reported going to their family doctor most often when they needed care. And this number has been virtually unchanged since the Health Council issued its first report on primary health care in 2011. When patients can't get care for their pressing health need in a timely way, they end up in our emergency rooms. It is not the appropriate place for that type of care at any time, but especially right now. Several days ago, I tweeted a picture of the Health Emergency Operations Center on New Year's Day. The room was full of people getting ready for Omicron, and they were connected to partners throughout the province, all working to get our system through this crisis. Throughout Christmas and over New Year's, that team worked on plans to get our province through the challenges we are facing today. They are working behind the scenes, even as I speak, doing their best to make sure New Brunswickers get life-saving care. The project I am announcing today is a critical piece of the work that began over the holidays. Through a partnership between the Department of Health, the regional health authorities, Extramural and Ambulance New Brunswick, and community health providers, we are accelerating plans to provide New Brunswickers with solid alternatives to the emergency room in the community. Je tiens à préciser que les
I want to be clear. Emergency departments throughout the province continue to see patients for their emergency health needs, including chest pain, signs of stroke, or broken bones. If you are experiencing an emergency and think you might need urgent transportation to the hospital, I urge you to call 911.
clear. Emergency departments throughout the province continue to see patients for their emergency health needs, including chest pain, signs of stroke, broken bones. Individuals who fear they might hurt themselves or others and victims of sexual assault should still come to the hospital. If you are experiencing an emergency and think you might need urgent transportation to the hospital, I urge you to call 911. An ambulance will be dispatched to your home just as it always has been. However, paramedics will use their clinical judgment to determine whether transport to the hospital is required or if other healthcare options are better suited to your needs. Paramedics are highly trained health professionals and are trained and qualified to do this assessment. Beginning Monday, they will have the option to treat and release. Si vous avez un médecin,
If you have a family doctor or nurse practitioner and need access to general healthcare services, you should continue to contact your provider first for an appointment.
or nurse practitioner and need access to general healthcare services, you should continue to contact your provider first for an appointment. If an appointment cannot be made in a timely way and the health need is pressing, other options are available before visiting the emergency department. Pharmacists can now renew prescriptions whether you have a primary care provider or not. They can answer questions about medications, prescribe treatment for minor conditions, including urinary tract infections, skin conditions, fungal infections, and answer questions about vaccinations. You can call 811 at any time of the day or night to receive support from a nurse and get a referral to additional services in their communities. The Telecare 811 service has been expanded to include in-person community appointments and virtual appointments that can be accessed within a 24-hour period. Walk-in clinics and virtual walk-in clinics like eVisit NB can provide a consultation with a nurse practitioner or doctor for common illnesses, injuries, infections, mental health conditions, and general health concerns. eVisit services are being offered at no charge to anyone with a valid New Brunswick Medicare card. To help improve access to services by providing faster first contact and reduce wait times, a new service delivery model called one-at-a-time therapy is now available in most of the addiction and mental health centers across the province. These services can be accessed either by appointment or walk-in. More information on available resources for mental health and substance use, both virtual and in-person, is available through Bridge the Gap. Given the speed with which we have pulled this project together, there will undoubtedly be bumps along the road. But I believe today represents an important turning point for primary health care in our province. Nous proposons
We're proposing to New Brunswickers with real alternatives to the emergency department.
with real alternatives to the emergency department. We are demonstrating that we can use technology to connect New Brunswickers to the care they need. Pharmacists and paramedics will be using their training and skills to have an even greater impact on the lives of New Brunswickers. All of the learnings of this project will be used in the development of the primary care network promised in the health plan. Work remains to fulfill our vision of a completely integrated system of community services, and changes will be likely. However, these are critical steps forward that will inform our journey and provide New Brunswickers with access to better care. Thank you. Merci.
Thank you.
Merci beaucoup, la ministre Shepherd.
Thank you, Minister Shepherd.
Nous allons maintenant
We will now move to reporters' questions. You have the right to ask your questions in the official language of your choice. Every reporter will be allowed to ask one question and one follow-up question.
questions from members of the media. You have the right to pose your question in the official language of your choice. Each reporter will have one question and a follow-up. Avant de commencer, j'aimerais informer tout le monde
Before we start, I would like to inform everyone that Mr. Richard Osier, the director of EMANB, is in the room if you have any questions to ask him.
to notify everyone that Richard Lozier, the Chief Executive Officer of EAMMB, is present in the room should you have any questions. Laura Brown, CTV.
Hi, Minister. I do have a COVID-related question. Over 50 deaths since January 1st. There's a lot of questions as to why. I understand there are more cases because of Omicron, but are these due to outbreaks at nursing homes, or were they mostly already in a hospital suffering from something else? There are calls for more information on the high death rate. Can you tell us anything more?
I believe that you'll have a COVID update later this week, but what I can tell you is that the majority of cases have passed in hospital. So there's various reasons that we can just even anecdotally point to. The fact that our population is the oldest population in the country, the fact that we have a number of chronic illnesses in our population. And so all of these things play a factor. That's why vaccination is so important, why we continually push for vaccination, because it is your best protection, especially if you have chronic conditions, to avoid hospitalization, serious illness, ICU admission, and death.
Ms. Brown, do you have a follow-up?
Yeah, quickly. Are we still on track to moving to level 2 on Sunday evening?
That's going to be addressed as well later this week, but I will say the modeling looks good.
Thank you both. On va procéder avec Monsieur.
Thank you. And now we will move to Pascal Rajnov from Radio-Canada. Good afternoon, Madam Minister. So I would like to know what's new in what you announced today, aside from the fact that starting on Monday, paramedics can now do some treat and release. So aside from that point, are there any new items? I'm not sure that I understand what we have new here that will help us alleviate the pressures in the emergency rooms.
I understand the question. One of the things that's most important is for people to know that they can access care without having to go to the emergency room. If someone has an emergency, they still should call 911. That's very important. But if you have a lower acuity of need, less urgent, not an emergency, you could call 811. And within a 24-hour period, they will be able to direct you to a virtual or in-person physician or nurse practitioner appointment so that your needs can be met, not only without waiting several hours in the emergency room, but in a very timely fashion. So that's certainly new. The eVisit NB contract that we have signed is a part of supporting this virtual and in-person visits, but we have many physicians around the province who have made appointments available so that we can make sure that we get to every part of the province. As well, your pharmacist can certainly help with prescriptions renewals and in assisting in minor ailments. So this is about showing New Brunswickers that not only have we been able to continue to utilize the services we've had with pharmacy and partners, but we're expanding it. We need to alleviate the stress on our emergency rooms and our emergency room healthcare workers. And so this is one way that not only can we do that, but we can provide better service to the people of New Brunswick for their healthcare needs.
Thank you. Monsieur Rachnog, as-tu un suivi?
Ouais, j'aurais une question de suivi.
Yes, I have a follow-up question for Mr. Lozier in French. Could you please explain what's going to happen with the 811 and what the minister just stated about the virtual appointments or in-person appointments that can be done within 24 hours? A few weeks ago, the government announced the project for those who have no family doctors. So the initiative that's announced today, is it for people who have family doctors but who can't get any appointments quickly enough? So can you please provide us with some concrete explanations?
Monsieur Lozier would not be as informed about this as I would be. He is here to answer questions in reference to Ambulance New Brunswick. So what I can tell you is that this is a part of the health plan. And staff have worked very hard over these last few weeks to ensure that we were able to launch parts of our healthcare plan. This is a preliminary project that will give us good insight into how we can evolve the primary healthcare network so that every New Brunswicker has the opportunity to have access to primary healthcare, to see a doctor or a nurse practitioner when they need to. That's the whole point of this project.
Thank you. Andrew Wall with Brunswick News.
Hey, Minister.
Hello.
This project has the projected impact of what this is going to do with hospitals been factored into the modelling for hospitalizations for going forward? Like when we talk about moving to level 2, will this be factored in?
It will be later on, but it isn't right now. What I can tell you is that we have about 600 appointments a day available for this use. And so as we see the uptake and as we see the diversions from the emergency room, we do expect benefits. We expect ambulance offload delays to get better. We expect people to have better care sooner. We expect less wait times in the ERs. And so all of these things combined are going to result in better care and, I would hope, less and fewer hospitalizations.
Mr. Wall, do you have a follow-up?
I certainly do. This sounds like a fairly significant increase in scope of practice for paramedics, pharmacists, potentially others. Are we talking, was there any money involved in this project? Are they going to get paid more to do these additional things, or is this, just literally we're expanding your scope of practice?
We've already negotiated with the Pharmaceutical Association for these additional scope of practice improvements. Pharmacists have been doing some of this for a while. I can also say that the Paramedic Association has been very enthusiastic about expanding their scope of practice within their work, and we know that we have advanced care paramedics who have additional trainings who can be very supportive in these roles. This is really allowing everyone to work to their full scope of practice. And yes, there is for a limited time while we're under the crisis of Omicron, we have a new fee code that will be applicable. So when people are referred from 811 or the emergency room to one of those 600 appointments, there is a fee code associated with it. Whenever you increase access, you will increase the cost. But we know that this is what good healthcare is all about. So that's all being absorbed right now in our system.
Thank you.
Thank you. Vicky Hogarth with CHCO TV.
Thank you, Bruce. Minister Shepherd, also from, I guess, a financial point of view, let's say a New Brunswicker went to an emergency room for a reason that could have otherwise been looked after by a family doctor or a walk-in clinic. How much more costly is it for a person to use an emergency room versus a family doctor? And will diverting from emergency rooms be a significant financial benefit to taxpayers?
Well, I believe it'll be a financial benefit. The emergency room is there no matter whether people show up or not. So those costs remain constant. This new fee code for these appointments, though, will offer better access to the care that individuals need in a timely fashion. So they're not going to be sitting in an ER for 4, 6, 8, 10 hours waiting to have something looked at that could have been addressed in an in-office visit. So this is why this is so important, because people will be getting their needs met, and the physicians and nurse practitioners that have stepped up to help provide this service are being compensated as well. So access always will cost more, but this is what this is all about to our population. Population health improves when they have access to primary health care.
Thank you. Ms. Hogarth, do you have a follow-up?
I do. I'm wondering if you can expand a little bit on how pharmacists will be integrated into prescribing medications. Is it just for renewals, or will they also be diagnosing some ailments? You mentioned UTIs as an example.
Yep. So UTIs was the most recent added to the pharmaceutical diagnostic scopes. And so they'll be able to prescribe for UTIs and for fungal infections and for some skin conditions. And of course, we'll see what the future brings with expanding on any of these services. But for right now, pharmacists have played a big part in our healthcare system with our vaccination rollout clinics, and so this is just one way that they've been servicing the public and how we can expand on it for the future.
Thank you both. Erica Butler with CHMA.
Thank you, Bruce. You mentioned the increased ability for paramedics to treat and release patients. I was wondering if there is any update on the effort to allow patients to be brought across the border to Nova Scotia, especially in the Tantramar area, where the local emergency room is only open 8 hours a day right now, and the Amherst Hospital is so much closer than the Moncton Hospital. Has there been any headway in that effort?
I can't give you anything on that today. We'd probably refer you to Horizon Health Network for comments on that, and I'll ask them to get you an answer.
Ms. Butler, do you have a follow-up today?
Yes, I do. I guess I'm still just trying to work out exactly what's new in this sort of package that's being announced today. What you're describing, the 811 referral to primary care, is this the actual launch then of the previously announced primary care referral program that we had heard about?
This will most likely morph into that, but what we're doing now is really an ER diversion project. We're trying to lighten the load on our emergency rooms so that they are able to address themselves to urgent and emergency care. The flip side of that is that we do have the primary care network as a goal coming up very soon in this new year. And so this is going to give us the opportunity to examine how those services are delivered and how we can improve it if we need to make tweaks before moving forward with the bigger scope. And so I am excited because in the big scheme of things, this is the preliminary trial run, but we need to right now focus it on urgent care and the diversion from our ERs so that we can benefit our offload times, help our emergency personnel, healthcare workers that are frontline, deal with urgent and emergency care.
Thank you both. On va maintenant procéder avec
And now we will move to Alexandre Boudreau from Acadie Nouvelle. Yes, so I'm wondering if emergency rooms can refuse patients, if their medical patients are not deemed urgent enough, will we ask for those patients to call 811?
The intent. However, emergency rooms could refer individuals to another location through 811. So it'll be done in collaboration, and it will be done in the best interest of the patient.
Monsieur Boudreau, as-tu
Do you have a follow-up question, Mr. Boudreau? Yes. So just a clarification for Mr. Lausier, will paramedics take into account the delay when they need to decide when to treat a patient at the hospital, the time to transport them at the hospital, or if they need to treat the patient there on the spot? So thank you for the question. No, it's not going to be a factor for paramedics when they're going to get on the scene. They do not yet know what the transportation time will be. It will be based on the clinical data for patients according to protocols that were established with algorithms to determine whether the patient needs to be transferred at the hospital or not. So if patients need to be transferred at the hospital, they will be transported. And if the patient does not need to be transferred to the hospital, they will give them some information about where they will be better served according to their current state.
Sutherland with CBC.
Good afternoon. Minister Shepherd, you've said that e-visit services are available to anyone with a Medicare card, but with Omicron cases surging and chiropractors and dentists and veterinarians, everybody being asked to assist with COVID vaccinations, I'm just wondering how there are any healthcare providers available for this service.
Well, that's the whole point. This has been done in collaboration with the MBMS and eVisit NB to ensure that we have these additional 600 appointments available throughout the province. And so we have certainly maximized our vaccinators, and to the tune that we're able to do, I believe, 60,000 plus appointments a day, and I think we were working up to 82,000 to be available. So we're covering all our bases, and that's really what I'm so proud of with the staff that have worked on this tirelessly since before Christmas. And they've really looked at every aspect of our healthcare system to how we maximize these opportunities. It truly has been an all-out effort, and I'm grateful to each and every one of them for all the work they've done.
Thank you. Ms. Sutherland, do you have a follow-up?
I do. So in November, you pledged to make primary care available to all New Brunswickers in early 2022 by transforming the online registry of people without doctors into a referral system. I'm just wondering, how close is that system to being up and running, and are you still looking at providing, I think it was 375 doctor appointments a week?
Yeah, so that's on the go as well. Still being worked on, and actually Medivy is a partner in that with us. And so that's being put together. This project is going to help inform us in how that's going to go forward, and that's why this is so important. And I'm so thrilled that we've launched this part of it.
Thank you. Thank you both. We're now going to go to Suzanne Lapointe with Global TV.
Hi there. A common barrier to help with mental health, and we've established that during the pandemic, mental health and addictions is becoming a large concern, is often people aren't able to get controlled substances renewed by pharmacists because a lot of psychiatric medications are controlled substances. So with this change with pharmacists, are they able to renew prescription for controlled substances?
I'm not aware that they're going to be able to address this particular part. However, hopefully with these family physician appointments, we will be able to address that in a more timely fashion.
Thank you. Ms. Lapointe, do you have a follow-up?
Yes, I also want to know how exactly, you mentioned earlier that this would help address the problem of offload transfers at hospital. How exactly is this going to reduce the offload transfer times?
So first off, when we have treat and release, ambulances may not have to transport cases to hospital, and I think Mr. Logier could certainly speak to this after I'm done, because I think he would have some important information to relay to you. So we also have many other projects on the go. So first off, if people don't have to go to the ER, then there'll be less people there to treat. If they're able to get treated in community, which will be far better for them without having to wait hours at the emergency room to get to see an appointment with a family physician or nurse practitioner, that will result in less wait times in the ER. If the ambulance doesn't have to transport to hospital every single call, then that will take up some of that space, free up some of that space in the emergency room for other calls. When we now have social development working with admissions and discharges right in the emergency room. That's having an effect as well, and not having to admit as many patients from seniors or disability, and getting them back to their homes and their community sooner. This is going to be a culmination of many efforts that are going to help support frontline ER healthcare workers. And it's about getting the right care for the patient at the right time and in the right place. And I'm just going to ask Mr. Logier to speak to that.
Thank you, Minister. So regarding offload delays, of course, we believe this will help to diminish the volumes that will be going to the hospital. Every year we have approximately what we assume based on our numbers, 20,000 calls that are or at least less acute and should not be transferred, or potentially not being transferred to hospitals. They could be better served, I might add, by their family physician, walk-in clinics, pharmacists, calling 811, than going to the ER. Those numbers are recurring. When we speak to our paramedics, they know that also, and then they get caught in offload delays because these are not high acuity patients and they don't need the urgent service, so they will not be seen as fast. And there's one thing I will add to that. We're encouraging people to call 911 when it's an emergency. It's very important that it's clear when you have chest pains, you have a fracture, and multiple other emergency needs, that you call 911. What we're asking now, because of the current situation, is when it's not urgent, you sprain your ankle, you bumped your knee. Unfortunately, some people do call ambulances, and even some people post on social media that if you want to get through the emergency department faster, call 911 and get into an ambulance. That is totally false. And what that does, that concerns us dramatically when we see this stuff, because we're removing a vehicle and highly skilled professionals off the road that could be probably respond to more important calls. So that is crucial that that message is out there. 911, use it for emergency services, and we'll be there. So going back to the offload delay situation, if we eliminate those 20-ish thousand calls a year, it will have an impact on offload delays, and we're positive about that.
Thank you both. Ailish Bonang from CTV.
Thank you, Bruce. Minister, I would appreciate if yourself spoke to this, and also Mr. Logier, if possible. Certainly not discrediting the education abilities of paramedics and pharmacists, but the time spent in school to become a practicing physician is exponentially higher, which kind of leads me to believe that some patients won't be happy about a paramedic possibly refusing to transport them to hospital. Mr. Logier, you kind of spoke to it that, people are trying to find loopholes on how to get through quicker. I'm wondering what you might say to folks who would have, questions regarding the ability to make choices such as this by paramedics?
So what I can say is that, you're right, paramedics are highly trained individuals, and advanced care paramedics even more so. And so, this is not something new. This has been happening in Nova Scotia. It's been happening to our neighbors in Maine. And so this is something that they have distinct protocols for. So I'll let Mr. Loger speak to it.
So we've established with our partners, the Paramedic Association of New Brunswick. Since I have the mic, I will thank Chris Hood and Derek Assista, our medical director, provincial medical director, Department of Health, folks at A&B and Medivie Health Services to build protocols for this project. As a paramedic comes in, they always assess, every time they go on a call, they assess a patient, and they're very strong at that. They assess the patient, and then, because what the information they receive from the dispatch center is limited, because that's the information they receive by the patient sometimes, and it's not complete. Paramedics come in, they do a full assessment, and then they will determine, based on protocols and algorithms that have been established, if it is needed to be the patients need to be transported or not. If it's not, they will leave information. They will direct the patient to the appropriate or potential appropriate caregivers, and they could be better served than waiting hours in an emergency room or in hours in the back of vehicle in offload delays. So it's just better care for the patients. And then the urgent patients will be seen and taken care of in a better manner.
Thank you. Ms. Bunning, do you have a follow-up today?
Thank you both. I do. Minister, you mentioned that this is a preliminary trial run of this project. Is there a set end date for these changes, or is it kind of a, see how things run? And again, you mentioned starting Monday, I believe?
So Monday is when the paramedics will be beginning their treat and release protocols. And that's really just because we need to arm them with the additional information that they can leave with patients, so that they know they're not, that they'll have the proper follow-up. But we soft launched the 811 and the ER referrals last week, and so that's ongoing. We do see being evaluating this mid to late February. The contract with eVisit NB is contracted until the end of February, and we will be assessing their appointments and the other physicians and nurse practitioners that have come online for this. So the evaluation period will be between now and the end of February.
Thank you. Travis Fortnum with Global News.
Hi, Minister. I wanted to ask about COVID-19 vaccine rollout, specifically in the 5 to 11 age group. I know the past few days there's been something of a push to bring the numbers up among that age group. Wondering if the province is making any changes to roll out to get those numbers up.
There'll be more speaking to it later this week, but what I can tell you to date, we have 55.3% of children in that age group who have received their first dose. And so we surpassed the 30,000 mark today. We will continue to encourage those children to be vaccinated, because we know that the more of our population that's vaccinated, the more we can suppress transmission and try to keep our cases down.
Mr. Fortnum, do you have a follow-up?
Yes. On that note, NACI issued recommendations about around boosters for immunocompromised kids yesterday. Wondering if we're going to hear more about New Brunswick's plan to start offering those this week as well.
Most likely you will, but Public Health they just released yesterday, so Public Health is going to be going over that information. I'm sure Dr. Russell will have more for you on that.
Thank you.
Thank you both.
Thank you.
Tim Roselle with Global TV.
Hi, good afternoon. Minister Shepherd, I wanted to ask you about the memo that went out from the Department of Health last week to the professional organizations for dentists and chiropractors and veterinarians regarding training for vaccination clinics. Just wondering if you have any kind of a target for the number of those professionals that you'd like to have trained in that area, and what kind of uptake you've seen so far.
I don't have a number target because we're accepting as many as possible because vaccination is our priority. So what I can tell you is that even everyone who gives a COVID vaccination received training in how to do that, and in certain specifics I can't even tell you what they are because I'm not a clinician. But so that call out was to ensure that that all of these associations knew that we would welcome their help, and we'll get as many of them as we can.
Mr. Rosell, do you have a follow-up?
Yes, I do, Bruce. Thank you. And just to further expand on that, I wanted to ask you about the compensation for those professionals. I believe on the memo it said $142.80 hourly. There's a suggestion from opposition and even from some members of the medical community that that these professionals are going to be compensated quite exceptionally for doing this extra work, whereas nurses and paramedics, both active and retired, have been volunteering in these areas and perhaps not getting the same level of compensation. Can you tell me if the nurses and paramedics that are active and even retired that are coming back to help out, if they're getting any kind of similar compensation to what is being offered to the dentists and chiropractors?
I can tell you absolutely that every professional working on behalf of the regional health authorities is being compensated at the rate that their profession normally dictates.
Thank you both. Jeannick Godin avec Radio-Canada.
Oui, bonjour,
Yes, good afternoon, Madam Minister. So we want to alleviate emergency rooms and reduce the workload for family doctors with this new formula to tell people to call 811, paramedic services and pharmacist services. With this strategy, are you also going to keep recruiting family doctors and working on retention of doctors who are already working within our system?
Of course. Family physicians retire. They leave for various reasons. If so, what I did state earlier is that 91% of New Brunswickers have a family physician or nurse practitioner. That's one of the highest rates in the country. However, we've always continued recruiting. We work with the MBMS, we're working with our regional health authority partners to ensure that we continue to have opportunities for any physician who wants to work in this province. So that continues on a daily basis.
Monsieur Godin.
Mr. Godin, do you have a follow-up question? Yes. And if possible, I would like to get an answer from Mr. Dozier and also from Minister Shepherd. So when we deal with pharmacists and paramedics, when they take care of patients so that they could be better directed within our healthcare system, is there not a risk somewhere that specialists, or we would bypass family doctors and that pharmacists and paramedics, for example, would direct patients to a specialist instead? So how is the system going to work to make sure that, yes, we alleviate the pressures in emergency rooms, but then we could increase the pressures on specialists?
I'm not sure I quite understand what you mean by putting more work on specialists. This is to deal with everyday primary health care needs. Those issues that come up to someone in a day who's had back pain for a few days, or someone who's not feeling well and they're not sure what's wrong with themselves. This is about not having to sit in an emergency room because you are triaged as a level 4 or a level 5, which is a lower acuity of need, and giving you better service by finding you a family physician or nurse practitioner in community that you can see within 24 hours. Many people, of those 91% of New Brunswickers who have a family physician, can't access their family physician in 3 weeks. So we need to make sure that people can get their health needs addressed in a timely fashion so that they don't get worse. And so 811 is a triage by a nurse to help understand if you know what your needs really are, and they'll send you to what you really need. And if you have an emergency, it's very important that you call 911. Utilize that service because that's what it's there for.
Moi, je peux ajouter,
Mr. Godin, so I would like to add that for paramedics, they're not going to refer patients to specialists. They're going to give them information and they're going to give advice to patients. They're going to tell them to turn to a walk-in clinic, for example, or nurse practitioner, pharmacist, if it applies, but they're not going to make referrals. Because those cases shouldn't require care at this level. For level 4 or 5, it can be a sore throat or ear infection. So those are not necessarily urgent care that's needed. So this situation wouldn't apply to paramedics. Thank you.
Sarah Seeley with Brunswick News.
So my question is, I'm looking for some clarification on the criteria or different skills for the unpaid volunteer positions as opposed to the unpaid versus the paid positions. I was just wondering if there's kind of like a difference in skills that are needed for those jobs.
So what I can tell you is that we're asking for clinical individuals to step forward and non-clinical. And so those, we've actually received 3,500 volunteers who have called and put their names forward. I don't have the breakdown yet of the how much were clinical and how much were not. I can tell you that about 30% have already been identified, and I believe they're prioritizing clinical first. And so we hope that by the end of the month, everyone who has stepped forward and volunteered will be contacted. They'll be assessed and vetted, and when I say vetted, it will be to their skills to see where they can be utilized.
Ms. Seeley, do you have a follow-up?
Yes, I guess my question would be why some professionals are compensated differently than others for doing the same sort of tasks.
So, as you can appreciate, every professional association has negotiated fees, and that is what the compensations are based on. We have, for the most part, utilized nurses for our vaccine clinics. We have put a push on to get vaccinations done as soon as possible and are therefore implementing as many professionals as possible to get this done, because it is the very best protection against serious illness, hospitalization, ICU admission, and death.
Thank you both. Mia Urquhart with CBC.
Thanks, Bruce. I'd like to hear more details from Mr. Lozier about how things will change for paramedics. Mr. Lozier, could you give specific examples of conditions for which paramedics would treat and release a patient rather than transporting them to hospital?
Yes. So once we get the 911 call through our dispatch center, our medics are dispatched to the address, and then they go on site and they'll do a full assessment, as they always do. Now, what's going to be added to that are two different algorithms and protocols to make sure that they're comfortable, they're following due process, and helping them make the proper decision based on the acuity of the patient. So your 1 to 3s are more urgent. So somebody who has chest pain, there's no question that they will be transported. Somebody who has an open fracture or a fracture of a limb of some sort, they'll be transported. Those type of calls, that's what we should be there for. Where we're going to determine when the proper caregivers should be involved is those lower acuity calls, a sore throat, a sprained ankle, a sore back, as the minister mentioned, that it's been there for a week. Somebody had, I don't know, if they fell and they got a sore back, a throat ache, flu symptoms. Those type of calls would be better served by their primary clinicians or through 811 and getting the appropriate person to take care of those individuals instead of going to the emergency department for potentially long waits, because they will not be seen quickly because of their acuity of their situation. So there's no doubt in our minds this will help the system, and it's just better care for the patient. So that's where we see it, and we're going to be monitoring this very closely over the next few months. We're going to assess. We're going to look at every call, and then we'll determine how we make it better even moving forward.
Sir, do you have a follow-up?
I do. If paramedics were already trained for this type of work, why wasn't this already being done?
So why wasn't this already being done? That's a great question. What I could say, I've been in position for 4 years now. What I could say about that is over the first 2 years, we've been discussing how we do a better job on this front. We were looking at different options, and we had one project that we did a tremendous amount of work on, and then COVID hit. And then that sidetracked, as you know, many projects, including many that we had on our plates. And one of the projects we had was what we called call mitigation. So treat and release or treat and refer was part of that. But once COVID hit, we were sidetracked. As you know, EMA and B, and I salute all our staff, pulled a humongous amount of weight over the last 2 years. And I can't say enough and thank our staff enough for what they've done, from our management of the outbreaks, the boosters, vaccinations in all the ARFs, swabbing across the board. EMA and B has not stopped, and it's been going on for basically the 2 years. So many projects, as we were talking about, were sidelined, although they were very important. We had more important things that we had to deal with.
Thank you both. Before we close, Minister, would you like to make a final comment?
I would. Thank you. First, I just want to say thank you to all of our partners, Extramural Ambulance New Brunswick, which has played a huge part in our fight against COVID. They have been on the front lines of this from the very first day and continue to be with their prompt teams and as Mr. Logier said, with swabbing and all kinds of things. The RHAs, Regional Health Authorities, Horizon and Vitalite, and Extramural A and B have all worked together with the Department of Health to move these projects along during a very difficult time, and the work has been exemplary. It's just simple. We need for the patient to get the right care at the right time in the right place, and that's what this is evolving to. Thank you.
Merci, Monsieur Lausier.
Thank you, Mr. Lausier and Madam Minister Shepherd.
Concludes today's press conference. Voilà qui met la fin à cette conférence de presse.
This concludes today's press conference. Thank you, everyone.